just take that under advisement later, right?
Yes.
But there's different things. If it's a first offense, it's 3 days, and then it could be more. It depends on how many offenses they have.
You all set?
Yeah, you're all set. He's putting the stream on now.
Okay.
Yeah, just make sure your speaker, everything's on over there.
Good afternoon, everyone. This is the Board of Health monthly meeting, which is a public meeting, and I would like to advise you that this meeting is being recorded. Also, we have in attendance Dr. Craig Andrade, who is the chair for this meeting today, and also Mr. George Fisk, who is member. And we have a full agenda today, and we also have some hearing this evening. And so, therefore, with no further ado, I am going to pass the mic to the chair of the meeting today, Dr. Andrade.
Welcome, everyone. Thank you for joining us. My name is Craig Andrade. Our first business is to take up our minutes from October 5th or November. Having read the minutes, any addendums, corrections, or changes?
None here.
None?
None
A motion to accept the minutes?
So moved.
So done. Second, a request for a hearing at this meeting. The following businesses have received notice to cease and desist orders and for selling tobacco products to persons under the minimum age of legal sale. Of the 7, 3 have been seen and not paid fines. We have some testimony.
Thank you. My name is James Plouffe. I'm the building commissioner in charge of inspection services. Here to read a little bit and kicked off the hearings for you, if I may.
Please.
Thank you. Good afternoon. My name is James Plouffe. I'm the Commissioner of Buildings in charge of Inspectional Services, and I'm here before you today to provide information and details regarding our efforts to enforce the Commonwealth of Massachusetts tobacco control laws. As you are aware, the City of Brockton formed Inspectional Services in July of this year and transferred governance to the sanitary and code enforcement inspectors that were historically part of the Board of Health. When this newly created department was formed, I, with my new Deputy Commissioner and Chief of Inspections, worked with the sanitary inspectors and code enforcement officers to modernize and enhance efforts of enforcement for all of the regulations, laws, and ordinances of the City of Brockton, whether it be the food code, inspection of rental units, tobacco enforcement, or any of the other numerous items that these inspectors are charged to enforce. Of importance for today's hearing is our advanced efforts in the enforcement of tobacco regulations here in the City of Brockton. Over the past few months, we have changed the way we issue permits by requiring an inspection of all permit holders prior to the renewal of a tobacco permit. We have also initiated spot inspections for sales of flavored tobacco products, which, as you know, are prohibited under Massachusetts regulations. In addition to our staff, the Executive Director of the Board of Health, under your authorization, entered into a memorandum of understanding with the Massachusetts Health Officers Association. In this MOU, the Massachusetts Health Officers Association sends out an agent funded by a grant from the Massachusetts Department of Public Health to assist the City of Brockton by completing compliance checks of tobacco retailers. These compliance checks are not only for regulatory items such as required signage and legal products, but they are also used to confirm that all tobacco retailers are adhering to the minimum age requirements set forth in Massachusetts state law. This age requirement compliance check is the reason we are here before you today. On November 4th of this year, an agent of MHOA, which is the Mass Health Officers Association, through the MOU, Memorandum of Understanding, visited 50 retailers within the City of Brockton. This agent employed a 16-year-old female to attempt to purchase a tobacco product from these retailers. I am happy to say that 43 of these establishments did not sell any tobacco products to the 16-year-old female. However, I am also dismayed that 7 of these establishments not only failed to ask for identification of the 16-year-old female, but also sold a tobacco product to her. Under 105 CMR 665, the minimum standards for retail sale of tobacco and electronic nicotine delivery systems, there is a penalty for the sales of tobacco products to an underage person. This penalty is a mandatory $1,000 fine and a suspension of tobacco sales for 3 days. However, as with all tobacco enforcement actions, there is an appeal process that may be asked for by an establishment whom has been issued a violation notice. Before you today are two of these establishments who we allege has sold to a 16-year-old female and they have asked for an appeal hearing in front of you at the Board of Health. With me today, electronically via Zoom, is both Sarah McColgan, the Massachusetts Health Office Association Tobacco Control Program Director, and Kevin Duquette, the MHOA Compliance Officer. They will be able to testify to how the program is run and how the compliance checks are conducted. I'd like to point out also that the only issue before you today is whether or not the 16-year-old female was sold a tobacco product. The fines and suspension are non-negotiable.
All right, good evening. Yaniv Sostiel, owner, Petrose Group.
Thank you. Thank you. You're here for
The hearing.
the hearing, so we would like to hear you. The directors would like to hear you.
I got to admit, I wasn't expecting anything like this, so official. I thought it's more personal. I wasn't really prepared for that, so I'm just going to shoot from my heart, okay? So I hear what Kevin? James, I'm sorry, what James have to say. And I gotta admit, as a father for young children, I'm all up for what's going on in here, and that's how it should be done, and I'm supporting it. I don't want my kids to be able to go, we don't live in Brockton, but I don't want them to be able to go anywhere and to be able to purchase any tobacco products, and this system should be there, in place. What I'm coming here today, and that's the reason I ask for this, is I own few locations in the city. They call it owner-operator, but I'm the owner of the business. I don't really operate it. I don't really stand behind the register and monitor every single transaction that goes through them 24/7. Impossible. But I hire these employees, I train these employees, impose all regulations, update the regulations constantly according to the state and the city, and on top of that, invest a lot of money in technology that always updating, that help to monetize it. Whether if it's a scan ID protocols that are now integrated to the register, that helps us a lot, to camera system that can go back way backwards. Back in the days, it was 14 days. This event like this happens, I don't even know who was the attendant. Today, we can go back almost 60 days and see who's the attendant, what happened, so at least we have the knowledge and how to fix and correct. So we invest money into this. And as I said, the protocols, I just asked to one of my employees to send a picture. I can show you there's piles of paperwork that they need to sign after they finish their training, that they're aware of their responsibility. This particular incident, the reason why we're here, is an employee that worked for us for a few weeks, went through the training. I have videos of him conducting the scan ID for tobacco sales, and so he knows the protocol. And he failed. I saw the video, and he failed in that particular transaction. Up to that moment, when this thing happened, I will issue a warning to the employee. They will sign on it so they understand, the weight of what happened, and maybe that will correct. But with that incident, I said, I don't know what to do anymore, and I fired this kid. I found out that he's a father that has a young kid right now, and this job really helped him, and I felt bad. But I didn't know what else I can do anymore. I don't know what else I can do. If I get someone in, and I train them, and I show them the protocol, have them sign, invest money in technology that helps me to monetize and help them to do their job correctly and still fail, need to pay the fines, need to revoke my license to sell tobacco for 3 days. Huge impact. I'm not Cumberland Farm. I have 3 gas stations. That's what makes money for my household. 3 days without selling tobacco, you can shut down the place. Nobody's going to show up over there, especially here in the city. So I came here to ask you, what do you think we should do more than that? Should I fire every employee that we find out is not following this protocol? Send them all home? Should we continue with the warning that sometimes help, sometimes don't? It's a very, it's a vigorous situation. Again, right from the beginning, when I heard him, James, talk, I listened as a father, and I said, you know what, it's right. This is how it should be done. They need to have these protocols. They need to protect the youth. I want them to protect my kids. But as the business owner, I hope that you guys can also see our side. If I was there and I failed and sell to minor, it would be stupid for me to even come here and show up in front of you. But again, as a business owner who asks to be trained, these employees, implement these protocols, invest the money in technology to help us conduct that correctly, what else can I do? Not just to prevent this issue right here tonight, but moving forward. Because this can happen again. I have 3 locations in town. We said there was 50 locations that were tested in that week. I'm pretty sure my other location, at least of them, was tested as well and passed. In this particular location at the main street, he failed. But how do we, moving forward from here, so I don't have to come here again and plead in front of you? Really, I'm almost speechless because I don't know what else I can do. I know the dollar amount doesn't make a difference for you, but I just asked my secretary to check. In the past 18 months, when there was an update and the option of the scan ID integrated into the systems, into the back office, it was almost $3,000 per location, $9,000 that we spent just for them to be able to scan an ID when they're conducting a sale. Unfortunately, and it's got nothing to do with us, when they scan an item, tobacco, it pops up on their screen that they need to scan the ID. But there is an option to override it if the person looks old enough. So you don't waste his time, send him back to his car, get his wallet, 50, 60 years old. There's no reason to ID this guy. So they created an override. These employees, they can just click override and sell the product. Right? We train them that they cannot do that. Person looks young, you take the ID, you scan it, and that's the only way it will enable you to conduct the sale. But that option where they can override it and continue the sale without scanning the ID, this is done by the big companies that providing these softwares and registers. I'm such a small guy to be able to change these kind of protocols on their end.
I mean, there's not much we can say here, sir. I mean, you heard from the previous speaker that we've had 40-something other institutions that were able to succeed without any mistakes. Human error is part of being human, and finding ways to override humans' mistakes are available. I know if I go to the package store, no matter how old I look and how white my beard looks, they scan my ID no matter what. And otherwise, I don't get a product. So, I mean, that may be the lesson learned here. I don't know if Sarah would like to have a moment to speak to this at all?
I'd like to have a moment. Being a Brockton businessman, as you know I am, I feel for you. But with my staff, we teach them the best we can. But the bottom line is when they screw up, it comes back on us because we're responsible for our business, no matter what. Maybe you've got to teach them a little bit better. Maybe you've got to pick a better sort of person. But I know we're all responsible, being business owners, for our employees. And if they screw up, it comes back on us, no matter what. And that's, I'm like a cigar every once in a while, so I like tobacco products. But, it's just that, when it relies on, one of your employees that screwed up or something like that, no matter what it is, you fired them, you did all you could, and you taught them, but it still comes back on you because you're the owner. No matter what, it would, something happened to my employees that did something, it still comes back on me, and it's probably just a good lesson. So don't let it happen again because it's a costly mistake.
I agree with you, but here's the problem. We got to a point where it's not, it got to a point where I can't really continue and train them, punish them, ask them to sign, a warning. I need to fire them. And is that what their city wants? 99% of my employees are city residents, right? Single moms, young dads. If I need to fire them because of these mistakes, I don't see where is the benefits for all of us.
There's no benefit. There's plenty of other choices. Again, you may want to connect with some of the counterparts that were able to succeed and not have those failures. This is always a challenge. Any team has weak links, and you find those weak links and you find ways to strengthen them. Firing isn't the only solution. All I'm suggesting, and from our perspective, you heard this is the legal procedure. We have no other choice here. And you knowing that is the case, have to acknowledge that as the owner of these businesses, your responsibility is to find the human resources that can keep consistent in a way that allow you to avoid these unnecessary costs. It's not for the city to say, what do you want us to do? Do you want me to keep on firing? That's not my responsibility or anyone else in this room. Your responsibility is to build a team that can be consistent and make you successful.
All right, I agree with that. But then it comes to the punishment. To lay down this kind of punishment of 3 days.
Again, this is a state rule. This is a state rule. And it was made in a way that made sure that we were consistent in Brockton and Avon, and Taunton, and on and on and on. The idea that particularly not wanting tobacco to be sold to minors. And so there is a reason that this has been taken out of our hands so that we can have some consistency. And that we can have a reliability and understanding that our youth in our city will be protected from having access to a dangerous material.
Again, the amount in here, the dollar amount, and on top of that, shutting us down for 3 days for this one fine, where most likely in this operation of that day, our other location passed. That's where I find it a little bit harsh. I came here telling you my situation and my story, not asking you to come here and tell me, okay, we get it and we'll give you the pass, but for future references. If this thing happens again, I'm back in the same loop. We're going to fire this person, we'll hire a new one, train them, sign them on all of these protocols, and then they can fail. They can fail maybe because they did it 100 times, but that one particular moment, they thought that maybe they knew this girl, regular customer, and it's coming back, as you said, coming back on us as the business owners.
Given the severity of this, I understand. I would encourage you to find a fail-safe to make sure that doesn't happen.
I did try. All right. Thank you. I don't know what else I can say. Thank you.
We have another person that wants to give some testimony.
Next, we have Crescent Variety, located at 163 Crescent Street.
Excuse me, Director.
Yes.
Possibly have Ms. McColgan or Mr. Duquette, the MHOA people online.
Oh, yes, absolutely.
Oh, please. Yes.
Before we do the next.
Welcome to bring their input.
Yes. BCA, can you bring them on?
Good afternoon.
Good afternoon.
I think we are on, yes. Good afternoon, Thank you, and I appreciate the opportunity to speak to you folks today. Sorry, there were some foul-ups with the Zoom link and everything, but I think we're all set. I think Kevin can hear everything. I'm Sarah McColgan. I'm the director of the Mass Health Officers Association Tobacco Control Program, and we've had a contract with the Department of Public Health and a memorandum of understanding with the city of Brockton for, I believe, 3 years now to provide tobacco control and tobacco inspections and compliance checks, youth access compliance checks within the city of Brockton. And Kevin has been the agent that has done the work for Brockton the entire time. So he's very familiar with the stores and their locations, maybe some of the management staff, things like that. I understand the concern of the last speaker. However, this has been an issue in Massachusetts for decades, and for at least 30 years. There have been local laws and regulations that prohibit the sale of tobacco products to minors, and that's been described various ages. Now, can't sell tobacco to anybody under 21. It was hard for Kevin and I to hear the audio for most of what the last speaker said, but towards the end, things improved greatly, and I appreciate that. And the store owner said, something to the effect of, well, maybe, this one day he thought he knew the person. And that whole scenario of I thought I knew the customer has changed, and that's been part of the problem. The state law is very specific and states that every customer purchasing a tobacco product, whether it's combustible or a vape product, every customer purchasing a tobacco product has to be asked for identification every time they make the sale. So it's just like going and buying age-restricted products at Fenway, at Gillette Stadium, at the Garden. You want to buy a beer, you have to show your ID every single time. And that's true with tobacco now since 2020. So the law has been in effect for a number of years and shouldn't be anything new to this gentleman. I did want to up, and maybe Kevin would bring it up also, the fact that PetroSave has had previous violations, and I don't know whether the Board of Health enforced on them or not, but there was a violation in April of 2022, April 30th, and then there was also a sale during a compliance check done by the Food and Drug Administration, and that was on October 28th, 2021. So this store has had repeated sales. You could say, well, but it's only once a year, but if that's your young adult, your child being sold tobacco products, it's not only once a year. It's something that we can't accept no matter how often it happens. And, as was said repeatedly, the state law mandates what the Brockton Health Department has to assess as far as a fine, and that there are permit suspensions on the first sale. So even though this is not their first sale, I don't believe that the previous sale was enforced on. And so, they kind of got a pass there. And then that brings us to today. So I'll leave it to Kevin if he has anything else to add. Thank you.
Thank you.
Thank you.
Thank you, Sarah.
Hi, thank you very much. Can you hear me?
Yes, we
Yes.
can.
Wonderful. So, I echo everything that Sarah did say. And I think I will add just the, the training process that the youth go through. There is an extensive training process that our youth go through. They need to go through this training before they can actually work for me. And so they understand, how they are to go about going into a store and requesting a product. It's very simple in nature. And, a lot of thought has gone into, how we go about doing these things and, the execution of it.
Thank you,
And I guess
Mr. Duquette.
if I could add one more thing, there's also training available online for retail clerks. It's available in both English and Spanish. I don't know if this gentleman has had any of his employees take that training online, but it's at my organization's website, mhoa.com, on the tobacco page. It's free and it's anonymous.
Thank you for sharing that, Sarah.
Mr. Chair?
Yes.
May I ask, point something out about these I guess the word would be sting, but the compliance checks that the MOHA has done for us. My staff, the sanitary inspectors, code enforcement officers, myself, my deputy chief of inspections, went through a series of trainings with Sarah regarding these kinds of programs, and we're intending it in the future to hire our own minor people, maybe between 18 and 21, maybe under 18, I don't know, we have to figure that one out, and do our own compliance checks. But one of the things that we learned is that what Kevin does is very specific. He goes out, he doesn't show his face, he goes off to the side, the young person gets out of the vehicle, walks down to the store, is given a certain dollar amount, is instructed to exactly what to say. If they're in question, ask for their ID, and say, oh, sorry, I don't have it, they have to leave. They can't lie, they can't say anything about themselves, they're a very strict protocol on how they attempt the purchase. So I didn't know if maybe, Kevin, you would wish Kevin to give you more specifics on these particular instances. I believe he's the fact witness here for the sales.
I appreciate that. If anyone of our members of the board would like to hear that, I would happily entertain it. I'm really familiar with the process, having worked with the Department of Public Health for almost 10 years, done some study in both compliance around tobacco as well as alcohol. I'm really familiar with it, and the consistency is consistent, and so I'm grateful for the partnership that Brockton has had, and for you and your team moving forward to take ownership of the process in a way that allows for expansion and continued consistency and quality. Does anybody want to need information about?
Well, it's just good to see that now, since we do have the health inspectors, I know we've been a little lax over the last few years.
Because of lack of capacity.
And people. So now, when you're forming this new inspector thing, we could see that, and now you're going to find them out more often. And you're doing your job, which, what I said in the beginning, it's good to see.
Thank you.
My understanding is correct, the statistics of tobacco use throughout Massachusetts is particularly high in southeastern Massachusetts. Is that still correct? Yeah. So there's a reason to be doing this, and I'm grateful for your service and work in this regard, and for the partnership here that has been demonstrated in this meeting. Thank you, all of you.
Thank you.
Thank you. And next, we have Crescent Variety, located at 163 Crescent Street, Brockton. Would you?
Point of order, Mr. Director. Is there a vote that needs to occur to hear on the appeal?
Basically.
So in the initial appeal, the first appeal for Petro?
That is correct. Because this is an appeal of the issuance of the violation and fine. And the board, I believe the board would hear this and determine whether or not the occurrence occurred.
Well, I mean,
Fairly obvious.
there is
It's
no,
just, yeah.
no question that the occurrence occurred. In our conversation with the owner of Petro, we I think in unison, have voiced our concern and understanding of the challenge that Petro has gone through. At the same time, believe that it is important to uphold this this fine and hope that moving forward they use this as a learning and opportunity. Do I hear a motion for?
Motion, we, can't accept the appeal, and we'll have to, our hands are tied.
Yeah.
Our hands are tied.
But as-
Unfortunately, that's just the way it is.
Motion made, a vote of I agree,
Aye.
and that is passed. You may proceed, sir.
Hello, everyone. My name is Jamin Soni. I'm the owner of the business.
Could you speak up a little bit more?
Oh, sorry. My name is Jamin Soni. I'm the owner of the business. Well, I understand all the rules and regulations, and we are very strict in checking IDs and all. Myself, whenever I'm there, I check IDs all the time. But it has happened by one of my employee, and I have trained him to checking IDs and everything, but it has happened by him. And I just took over the business a few months back. We are still settling up with business, and it's a huge fine for me to pay. And on top of that, 3 days suspension on selling. So that's a huge impact too. And my employee would also like to see something, if it's fine. Thank you.
Yeah, my name is Alexander Santana. I work for Jimmy. So the day in question when this happened, when he told me about the fine, and I told him, I said, no, it's a lie. It didn't happen to me. I was working that day. But unfortunately, I bring my daughter to work with me. She's 19 years old. She's learning how to do things, and I happened to be in the bathroom when it happened. Because the lady that came, the young lady that came, she came a few months back, and I was the one that asked her for ID, and I refused her, and she walked away. The same person, because I looked at the video, it was the same lady that came in again. Just my daughter was there, and I asked her to keep an eye, and I guess she sold tobacco to this lady. But I was the one working that day. It's really my responsibility. If I had the $1,000, I'd give it to him. But I told him it wasn't me, and like I said, I had to go to the bathroom and just, that's why it happened. If not, it would have never happened. And she comes to work with me all the time. That's the reason that happened. If not, it would have never happened. Because this same young lady, like I said, she's been there before. I remember her. Looked at the video, and it's the same young lady. I remember her from the first time she came. And I ID everybody. Even if you're 50 years old, I ID you. They make fun of me. They laugh at me when I ID them. Even 60, 70, I don't care. I just ID everybody. Just that day, like I said, I bring her to work with me, and that day she was the one that was there, and she was keeping an eye while I was in the bathroom. I was in the back when it happened. And she came in, and I guess the girl, she just sold the cigarettes, and that's it. She didn't even tell me nothing about somebody coming in and buying cigarettes or nothing. So when he told me about it, I said, no, I didn't sell her. No, it's a lie. But unfortunately, it did happen.
Yeah.
She did sell that young girl. My daughter's only 19. She didn't know no better.
There are a lot of scenarios of why mistakes happen. I appreciate that, and I appreciate you telling your story and the truth of how this manifested. Ultimately, as you heard with our previous discussion, this is the law for Massachusetts. I would again encourage you and your peers to look at the model for alcohol. It is part of the system. You can't have the product until you show the ID and the ID is scanned, and it's without exception. So if you can have a system that allows it to, you can't have the product, you can't pay for the product until the scan of the ID and the verification that they're of age, then it'll be unmistakably unmistakable.
I understand, I just,
So it's relatively new for tobacco. It's been in place for a long time with alcohol, and take that lesson and make it mandated so there's no way to override the system.
I understand.
Yeah, we can feel for you, but, I mean, it
Doesn't
goes
work
down
for
to
us.
the owner, you know, you're in charge.
Yeah.
You're in charge of him.
It was my
You're in
mistake.
charge of your daughter.
Yeah, it was my
I mean,
mistake.
it's an expensive bathroom trip, you know, that's all I can
and it's not
say.
your, I mean,
Very expensive.
it is about just not making the human error possible, so that you don't have to have the burden of this cost.
Yeah.
I understand the concern, I understand the burden, I understand what it means for a business, and I've also supervised a large number of people and understand the responsibility lies with the person that is in charge.
I get it. Maybe it's the time.
Thank you.
Thank
You're
you.
welcome.
Thank you for your time. Thank you.
So, do I have a motion to acknowledge that this incident did happen as well, and that
Fortunately, our hands are tied, and
the fine should be sustained?
Yeah,
Do I have a motion?
right here on the motion.
All in
Aye.
favor? Aye.
Aye.
The motion passes.
Mr. Chair, if I may, James Bluff, the building
Sure.
commissioner. Just a point of order, and just not to belabor the point, but would, I believe through council, we discussed, it should be a vote to overturn the appeal and uphold the violation.
Got it.
Got it, that's it.
Thank you.
Thank you.
So the motion has passed. That was the intent, to uphold the appeal and to move forward.
Thank you.
Thank you. We have one more testimony?
No, that's it for the day. There is a third appeal, but the person has asked for an extension to be heard in January due to a conflict in the schedule. So that's it for the hearing.
Okay. You're welcome to have a good evening.
Thank you very much. I appreciate the time of the board, and I hope not to have to be in front of you too many more times for these, but I look forward to seeing you guys again.
Well, thank you again for your
I have a
good
couple
work and
questions
for your
since I
team.
have you here.
Sure,
If you
absolutely.
don't mind. We haven't really had any inspectors, you know,
Yeah.
in quite some time in
Yeah.
any of our meetings.
Yeah.
So I'd like to hear a little bit more. Now, first of all, I'm very pleased with what you're doing now. You're right on the ball. Every meeting, I bring up about, you know, some of the new people, migrants, and people that are just, you know, in our city, you know, under the railroad bridges, the people panhandling. I don't know if it is a public health and a health problem. I mean, one of these days, one of these panhandlers, I nearly get hit, or something's going to happen, or somebody's going to get in a fight, and that's, you know, is going to be a health problem. And the people that are under the bridge, now, is it true that the state and the railroad, they're in charge of the people and you can't touch them under there? I mean, is there anything that you can do as inspectors to help out this situation, maybe find them places to stay, anything, because it's getting cold, and, you know, being on the Board of Health, I mean, I worry about these people, and I worry about people that are panhandling and some of these things that are happening in the city, especially, I don't know if it's just the homeless or if it's more the migrants. I'd just like to have your take on it a little bit and explain what's going on.
So a little bit off my radar is really those kinds of unfortunate human services issues we have. However, I'm part of a number of meetings and with the mayor, their social services director, and the Quality of Life Task Force. And we are meeting on a regular basis to try to find solutions. I believe council would be able to tell you a little bit about some of the circuit court's rulings that are regarding the people that are unhoused, and the difficulties that we have facing those individuals. Everybody has the right to a place to stay and live and be comfortable and warm and eat well. And I think that our mission right now is to try to help them all and try to help them to a way that they can live comfortably and healthy. Us as a department are pretty much enforcers of the rules that we're given. And unfortunately, there are no rules given to us regarding these situations at this time. It's kind of homelessness is not a new issue, but I think the issues that we're having here is new for us, and we're trying to learn to adapt and try to fix the things within our control. I don't really have any answers for you, unfortunately, as to what we can do to help with the situation. But I can tell you that we're constantly talking about new solutions and new ways of trying to help them. And this is Stacy Verde, our Assistant City Solicitor.
And good evening, Stacy Verde. I'm an Assistant City Solicitor. And certainly it is a very important topic as far as the unhoused population. Unfortunately, there are several circuit court decisions out there that have really tied the city's hands. Two of them are out of the Ninth Circuit that deal with that the unhoused population cannot be punished for being unhoused. And then that has grown into what else are they entitled to? They are entitled to their personal property. There are some decisions out there saying that they cannot be punished for public urination, public defecation, because if there are no public restrooms and they are unhoused without the offer of shelter, then they have no choice. And so right now, the big issue in Boston, and they have very specific guidelines and protocols, is if there are shelter beds available, this is what they can do. If there are no shelter beds available, this is what they can do. In Brockton right now, our hands are tied because we don't have the shelter beds. So all we can do are the protocols of when there is no shelter available, and that's very minimal. I am working with the ACLU to see if we can come up with some policies that will protect the unhoused population, protect the residents of Brockton, and also be within the bounds of the Constitution and all the legal issues that are out there right now. There's a big push for the Supreme Court to address this issue because the cities and towns need it. They need it addressed. They need to be able to deal with the needles and the public urination and the panhandling, and right now our hands are tied legally.
You explained it to me very well, but I was just, it seems like you're on it, at least, I mean, if you, like us, sometimes our hands are tied too.
Well, we should also acknowledge that ultimately this is a systemic problem that is nationwide. I work right next to Mass and Cass at the Boston Medical Center and the School of Public Health. We have dismissed our housing needs for decades, and as the country has dismissed its housing needs for decades, and therefore we are at this place because we have lost our ability to take care of our poor, to take care of our unhoused, to take care of those that are substance use addicted, and on and on and on. And hopefully we find a way to have a systemic approach that allows for everyone to have the home that everyone deserves. And that's going to take all of us kind of moving beyond kind of the legalistic perspective to find the ways to the solutions that allow for, these could be our mothers or fathers or sisters or brothers, right? Find a way to make sure that we are taking care of all of us, because it, for the grace of God, could be us.
Yes, there was certainly a period of time where there was much more focus on domestic violence shelters and mental health hospitals, and unfortunately, I think that has not kept up with the need.
If there's any of us that can help in those conversations, again, this is happening across the state. The city of Boston is just the center in a sense, because places like Brockton don't have shelter beds in ways that we could, and therefore our unhoused are moving to Boston or sleeping under the bridge. Thank you again for all you all do. I appreciate you.
Yep.
Thank you very much.
Yep. Thank you.
Have a good evening.
Thank you. Thank you. Sarah, are you still on with us?
I am,
Okay. Well, I don't know if I want to say much longer, but the hearing is over. The hearing section is over. Now we're going to proceed with the rest of the Board of Health meeting. So you're welcome to tag along. And I don't get to see you that often. We don't get to see you that often, but thank you highly for attending.
Well, thank you for the opportunity to speak, and I'm glad we got the Zoom situation worked out. And have a good evening, everybody. Thank you.
Yeah, thanks to
Thanks
you.
for your work, Sarah, and for your teamwork.
Yeah, and to
Happy
Kev as
holidays.
well.
You also. Bye-bye.
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 So moving on to item 4, moving forward with life science, bio-ready community adoption for NIH guidelines.
Yes. At this point, I still do not have anything. I have shared everything that I was given through the consultant or the people that we contacted in other municipalities. And so I shared with the mayor and Mr. Rob May, who is the planner for the city. And so the Board of Health doesn't have anything to add on the record at this point.
Thank you. Item 5, sanitary health inspectors.
Yes, basically, you have seen some of the move this evening because the sanitary inspectors, which were under the Board of Health, are now working under inspectional services.
Stop rubbing it in,
Yes.
Seems like it's working.
Yes.
So for item 6, statistics on COVID.
Yes, just maybe before, okay, we could move into this, but also let me mention also here that as we go into item 6, I'd like to also highlight that we have 2 vacancies at the Board of Health. That is under a grant by the Department of Public Health to actually hire individuals to do work for epidemiology, and also as community health workers. So at this point, we are about to start some interviews for an epidemiologist and 1 community health worker. By next week, we should have interviews and perhaps complete that by the end of the week or the beginning of the following week for those 2 positions. That will be an opportunity for us to continue to serve the city of Brockton. The epidemiologist, we don't have one at this point because we ended up the fiscal FY23 and then had to close the book and then start over. With respect to the community health worker, we do have 2 at this point. One, they have to be, all of them have to speak a language other than English in order to be consistent and culturally competent with the populations that we serve. So the 2 that we have right now, each speaks 2 to 3 languages, including the one for a particular ethnic or another specific demographic, and then the one that we need to hire presently needs to be also to be able to speak another language. And the one that we're hiring, we hope to hire, will have to be fluent in Spanish.
That's good.
Yes. And moving to the stats, basically we continue to see uptick in COVID statistics or dashboard. So basically the numbers increase, decrease, but it's not zero. Today we had 10 new cases on MAVEN, which is the Massachusetts network, epidemiological network that does the surveillance. So one of the caveat when we look at statistics these days, unless the people who are tested, they do it with an institution such as a lab or a hospital. Everybody who tests at home with the home test kits, we don't have those stats, and so therefore, when we say we have X number of individuals, it is a very conservative number that we give, and so therefore, presently, we would say as of today, December 7, if we go back to the first case that was recorded in the city of Brockton, we have a total cumulative cases. Those are approved. 34,873 cases of COVID. Now, what does that really mean? It means that anytime that someone was given a positive test, and it is recorded on Maven, that number could be either the first time or it could be maybe the second time. So which means that the 34,873 cases doesn't necessarily mean that those are the total individuals who got tested, but those are the total tests that came out positive. And so from that, we may add that 539 people died, and the pathology was COVID-related. And then for active COVID cases for the last 7 days, it's 99 cases, closing with today's number, which is 10 new cases.
So since the Department of Public Health has stopped reporting positive testing data, do we need to continue to count this other than those that are reported cases that have gone to the hospital and those that have died? Those are the real numbers that we can count on. Otherwise, people are testing at home. There's no need to be tallying these numbers anymore. Is that what you see?
Yeah, that is accurate. But basically, because DPH still records them, so we keep track of them. And then we follow up with a phone call, or if anyone contacts us after a positive test, then the Board of Health responds accordingly to those cases. So that is why we no longer have contact tracers or case investigators. So that's the old days, or the days of the pandemic. Yep. But presently, we are dealing with the endemic phase of COVID, so we don't trace every case down, but we just keep this up for at least to let people know that COVID is not out of the picture. And so therefore, precautions is still needed. And in fact, while I'm here, I may add that I know that holidays are coming around the corner. So it would be advisable that people do a little checkup, because you never know. And if you're attending large parties, it might be good to think about COVID and see how you can maybe keep your audience to a certain number and to personal precautions. And let me add that we do have kits for people who want to test at home. Now, we have limited numbers, but people can also call or go online, the CDC website, which is the Center for Disease Control and Prevention, and they can order their own kits. The new kits come with 5 tests in it, and a household can order 1 kit for each member of the household. And we will make sure that the link is also posted on the City of Brockton Board of Health site, so that people, if they look for it, they can find it if they don't have it.
Thank you, Eno.
Thank you.
Item 7 and 8 continue to talk about COVID. Do you want to give an overview?
Yes, basically, we continue to do COVID with the nurses. We continue to do vaccination. In fact, yesterday we had the last clinic to date, and they did a significant number of vaccination, COVID and flu. And so it is an ongoing. We do have an ongoing clinic at the Shaw Center, which is located at 1 Feinberg Way in the city, which is adjacent from the Registry of Motor Vehicles. So the nurses are there once a week, 2 to 4 p.m., and anybody can walk in and get a vaccine. The protocol to date is that anybody who has taken 2 vaccines, any kind, they need to have an additional one, which used to be called booster, but it's no longer called booster, but rather an updated dose. And that updated dose is bivalent, meaning that it prevents against 2 particular strands of the virus. And so therefore it is advisable that people continue to make sure that they're up to date, and particularly individuals who are 65 years old or older, or people who may have immunocompromised, meaning that they have some comorbidity, they live with some challenges, health challenges, and so therefore it is recommended that those 2, at least those 2 demographics continue to make sure that they remain updated with their COVID vaccination. There is another one that we could talk about, which is RSV, which is respiratory syncytial virus. DPH or the Board of Health do not give that vaccine for free. And so therefore, we recommend that all city residents or people who work in Brockton contact their PCP or primary care providers so that they can get that vaccine.
Thank you. So you've talked about vaccination through item 9. Item 10, infections for TB.
Yes, TB, we do have a slight uptick in the city. So the nurses work with DPH and the providers to make sure that these individuals who have a positive TB get treated, because TB, anybody can get TB, but the most challenging one, and that is the most infectious also, is the pulmonary TB. And so therefore, we continue to make sure that these individuals, they get treatment. And so far, we could say that all the individuals we have, they're on the countdown on treatment, because we don't have any new cases right now. But those that we have, some of them will be completing the treatment soon. Some of them by the end of this year, some of them the beginning of next year. Treatment usually lasts 6 months or 9 months, depending on how well the individual responds to treatment. So that's where we are right now.
That's good. That's good anyway.
Thank you. Health promotion and public health education is being provided by DPH?
Yes, because of the grant that DPH has allocated for the city, we have been able to hire staff. And as I mentioned earlier, we're hiring a new epidemiologist and a new community health worker. And so therefore, once we hire a new community health worker, that will add to the 2 that we have. And so they go out with the nurses to help doing health education. And they also work to collect information on the community health assessment so that we have an idea how well the city is doing and where we fail or where we are weak, so that we can intervene and provide assistance. So basically, we work with many partners. Yesterday, there was an event at the in the city at the community. At the Massasoit Community College that was spearheaded by Brockton Neighborhood Health Center, and it was well attended. And Board of Health was there. We vaccinated as well, both for COVID and for flu, and it was a good experience for the Board of Health and the city.
Excellent. A highlight around mental health?
Yes, mental health continues to be a challenge, and so therefore we continue to be part of the task force of the city around mental health, and also as an advisor to the statewide SAC member or statewide advisory council member. I have the opportunity to advocate for the city because we have other cities, municipalities who are under the same situation dealing with mental health challenges. I would say that resources are limited, but we work with the state, with the mental health department, to be able to see how we can best attend to the needs of those. There is a nationwide emergency number, which is 988. Now, 911 is if people have challenges like threat or violence or crime. But for mental health, the emergency, the hotline basically is 988 that people could call to get some help, and then they will be connected with a provider within the state for that matter. So we encourage people to work together with family members, with the health service providers to help allocate those who are in need and then connect them with services.
Item 10, item 13, miscellaneous around continuing remote meetings.
Yes, and so today we had that great opportunity to have that meeting hybrid. As we are here, we also had members who attended via Zoom, but the Governor Haley and Lieutenant Governor Driscoll have extended the ordinance so that we can hold meetings until March 31st, 2025, remotely. So basically, we will continue to work and be flexible as the needs are felt.
These new things, do you need to read through them, or can we go to item 14? Anything in particular in the new things you want to highlight?
Well, I will leave it to the discretion of the board to see if they want to have attend the next meeting, which will fall on Thursday, January 4th, because that's the next meeting. That would be the next meeting date for the board.
In between, we've had that during this time in the past, true?
I know in the summer we do.
Month of August or something like that.
We could skip a month, but as for January, we have, as far as I know, we have not skipped a month.
Okay. And any objection to meeting on the 4th?
I'm here.
Okay.
If we haven't been put out to pasture.
All relative.
Is that why it says tentatively?
Tentative, yeah. If our pacemaker's still working.
I was going to ask you about that tentatively thing.
Next board meeting on January 4th. Excuse me, January 4th. Do I have a motion to?
Do you have anything else?
No motion to close, to adjourn.
Yes, so a motion
make a
to
motion to-
adjourn.
Yep.
So moved?
Yep,
Seconded? We are adjourned.
we adjourned.
Good seeing you, gentlemen.